Hi friends, let's today talk about acne. Acne is an inflammatory skin condition that causes spots and pimples, especially on the face, shoulders, back, neck or chest. It's the most common skin condition occurring during puberty when the sebaceous glands are active. These glands are found throughout our body except the palms of our hand and soles of the feet. Sebaceous glands produce an oily liquid called sebum that helps skin from drying out. Our skin has tiny holes called pores that can become blocked by oil, bacteria, dead skin cells, ingrown hair, and dirt. When this occurs, a pimple develops. Acne is usually associated with hormonal fluctuations experienced during teenage years. But there are some other factors also that contribute to the acne. They are genetics, menstrual cycle, anxiety, stress, hot and humid climate, oil-based makeups, and squeezing these pimples. Acne are of two types, inflammatory and non-inflammatory. Let's first look into the non-inflammatory type of acne, that is blackheads and whiteheads. Let's see how they are formed. Blackheads occur when the pore of the skin is clogged by a combination of sebum. Sebum is the oily liquid secretion secreted by the sebaceous gland. So a combination of sebum and dead skin cells. When this blocks the pore, the top of the pore stays open despite the rest of it being clogged. So it gives it a black color. Whiteheads, on the other hand, are formed when the pore gets clogged by sebum and dead skin cells. But here the top of the pore is closed and it looks like a small bump protruding from the skin. Blackheads and whiteheads are the mildest form of acne, and they can be removed by the use of salicylic acid. Salicylic acid based moisturizers, toners and cleansers are the best to remove or get rid of these blackheads and whiteheads. Inflammatory acne occurs when the bacteria present on our skin gets clogged in the pores of our skin along with sebum and dead skin cells. This bacteria that gets trapped inside these clogged pores, they start growing there, and this leads to infection deep under the skin. That is when we get an inflammatory acne. They are of different types like papules, pustules, nodules and cysts. Papule is a solid elevation of the skin with no visible fluid. They are skin colored, pink or red in color. While pustules, as the name suggests, they have small bumps on the skin that contain fluid or pus, mainly seen in teenagers with hormonal imbalances, at white color pus. Nodules and cysts are the acne that lasts for many weeks or months. They remain as hard knots under the skin and they are very painful to touch. Retinoid-based gels are useful for combating inflammatory papules and pustules. And if the problem persists, it is better to get consulted by a dermatologist.